Hi everybody, I'm Dr. Gavin Scriven. People call me Dr. Gav, and with me is the founder of the non-surgical penis augmentation procedure we call Caliber, Dr. Jason Oates.
Thanks, Dr. Gav, and together we are the Dick Doctors, and we are going to be talking about all things penis. Our area of expertise is injectable penis augmentation. There's a lot to talk about penises, and together, myself and Dr. Gavin will be doing that.
Hi, I am Dr. Oates, and with me is Dr. Gav. Together we are the Dick Doctors, and today we're going to be talking about new evidence that maybe hyaluronic acid fillers last a lot longer than what we generally think. Welcome, Dr. Gav.
Thank you, Dr. J. It's great to be here again, as always. And today's a really interesting topic because apparently, according to this particular article that we've had a look at together, hyaluronic acid dermal filler that we commonly use in our penis injections lasts a lot longer than what we may think.
Yeah, very interesting. It came up in a conference that I was at recently. And of course, like a lot of good research, it actually comes out of Australia, Victoria. And there is a radiologist there, Mobin Master, and he also does cosmetic injections. This has just been released in the January edition of Plastic and Reconstructive Surgery, which is the biggest plastic surgery journal in the world. And they were investigating patients who had long-lasting swelling following hyaluronic acid. They had 14 patients, and some of these patients, in fact, hadn't had filler injections for over 6 years. And in fact, one of them hadn't had hyaluronic acid filler for 12 years. And then as they showed on the MRI scans, they could identify the hyaluronic acid. Hyaluronic acid is mostly water, and often where we're injecting it in the face is into fat, and they show up very differently. It's what's called a T2 weighted image. And I can remember, when MRIs first came out, and we would remember that a T2 image, the eye is the water, which is actually hyaluronic acid in the eye on a T2 image. And you're probably too young to remember all of this, but this is how we tried to remember what a T2 image was back in the day.
Yes.
And then fat was black. And so the useful thing here is hyaluronic acid shows up very white in the black fat. And that's how they were able to identify it.
Yeah. And it's really interesting because I guess when people are investigating if there is any retained hyaluronic acid, often the modality they might refer their patients for is an ultrasound. But I believe after a long time, once the hyaluronic acid is integrated very well within your tissue, within the extracellular matrix, it's not easily seen on ultrasound. And that MRI really, that T2 weighted imaging is the best modality to separate, to see the hyaluronic acid as a separate component to the fat.
Yeah. And this was somewhat of a surprise that 6 and 12 years later, they could clearly identify the hyaluronic acid there. And then they went on to treat that hyaluronic with Hyalase, and it dissolved the lumps away, which then also confirms that it's hyaluronic acid.
Yes, that's right.
And so generally, we would be telling patients that their hyaluronic acid fillers are going to last 12 months, maybe 18 months to 2 years in some of these newer and harder hyaluronic acids. But occasionally we'll see a patient who it seems to disappear in a few weeks or months. And that was the second finding of this study, is that the hyaluronic acid had migrated further than where it was originally injected. And in this case, the one that gave it away the most was the lips, where the patient had the lips, the pink part of the lips, the lip border injected. But with the MRI, it had spread right up into the white part of the lip, and it looked a bit like a moustache, a bit like what you've got there, Gav, except white and being under the skin. And that was, again, somewhat unexpected that that it had migrated so far, because we tend to believe that after that sort of first couple of weeks, 3 or 4 weeks, maybe that it's integrated into the tissue and pretty much stays where it is.
Yeah, definitely. And so I guess, that has implications for all of our injection techniques and also the locations of the body where you're injecting. Some areas might be more susceptible to migration, especially around the mouth, as you just mentioned, where you have the orbicularis oris that's constantly moving and compressing the area. May have something to do with that, the migration of that filler. So it is actually something that a lot of injectors are looking for now, that sort of upper shelf above the lip, that may be a bit of a giveaway that there's been some migration, and that it ends up with that not a very nice cosmetic appearance for the lips after someone's received multiple injection sessions and developing that upper white moustache, as you called it.
Yeah. And of course, this then comes directly back to our sort of patients, because when I first started developing this back in 2014, part of the concern was, well, if it all disappears in 12 months, it's maybe not really worth it. And then we got to sort of 12 months and thought, well, it looks pretty much the same now as it did a year ago. It's lasting longer. And the Koreans have published some studies, showing, good longevity, 90% still at like 18 months. And so that was encouraging for us. And, as you're very, familiar, it's common to see guys come back 2-3 years later and still have the majority of the circumference that they previously had. They may have 90% of their circumference, but sometimes it's mainly in what we'd call like the distal half of the penis, the end of the penis, and then the base of the penis is becoming somewhat thinner. And we've discussed this in the past and noticed it and say, hey, a guy comes back 2-3 years later, and all you have to do is fill a little bit around the base and it's all looking good again. And I think this study is actually putting some more evidence to what's going on there.
Exactly. And as you said, I have seen the same thing. And I have seen guys retaining filler for over 2 years, coming back with still obviously quite a lot of filler around the shaft of the penis, but it may have migrated a little bit distally. I have seen it the opposite direction as well, down towards the body, where it's migrated a little bit down towards the body, and all they have to do is fill up a little bit towards the distal shaft. But obviously the filler is hanging around, and it's lasting a lot longer than we initially expected, which guys are quite happy about.
Oh yeah, guys are going to be happy about it. Yeah, and that very slight migration fits in with what they're finding on MRI. Maybe we should be sending guys in for a series of MRIs on their penis, but I'm not sure how we're going to get guys to agree to that. It's hard to get them to agree to any of the studies that we're doing. But yes, so this idea that guys think, and everybody knows, filler is gone in 12 months, and we're saying, but in our experience, it's commonly there to 2 or 3 years. There's now solid evidence coming up that is a real thing. It's not just in our imaginations.
Exactly. And one other interesting thing you mentioned about that article was that even after that huge amount of time, there was one that was up to 12 years later, you were still able to use hyaluronidase and actually dissolve the hyaluronic acid and then confirm on MRI that had been removed. So I think that's another thing that guys feel comforted by our procedure, is that it's still reversible after that much time.
Yeah. So all really useful information. I guess what we should be doing is publishing some longevity studies as well. I'm going to be feverishly working today in our last day of lockdown here in WA, in putting together some of the current evidence for our study that we've been doing for over 2 years. So we can hopefully actually get something further published on this. But yes, it's encouraging news, good for guys to know that there is real evidence that hyaluronic acid lasts a lot longer than generally believed.
Excellent. Well, I think that about wraps it up for today's topic. And again, as always, if you've got any further questions about these studies or hyaluronic acid in general and the dermal fillers that we use, feel free to contact us, make comments, and we'll do our best to get back to you. But make the use of the last day of lockdown, Dr. Jace, and continue on your research. That's fantastic. And I can't wait to speak to you again soon about another interesting topic.
Great. Good talking to you, Gavin. Yes, looking forward to our next topic.
All righty. Don't forget, guys, confidence changes everything. And we'll see you next time.